see you again on Inside OC. Okay, we dissolve, and now we talk. This is the post-show open mic chatter, so this won't air, but it will be on YouTube forever. So whatever you say will also be on. Is there anything that we didn't get to that you really wanted to emphasize?
No, I actually was able to get that one point across that I really wanted to, was talk about the prevention and how I think we need to shift resources. We see a lot of individuals coming through the clinics with issues, with conditions that could have been prevented. A lot of stress-induced conditions. I call it, you know, the lion got them. You know, it's like when you're in a desert or whatever, and you're running away from that beast. They got caught, you know, pretty much because they didn't have the tools, you know, to live a healthier lifestyle, to have access to things that today, you know, really only affluent individuals are able to access, like acupuncture, chiropractic services, yoga. So I just think that it's very important to focus on that.
I think behavioral health is something that we're not doing a real good job at. I mean, we're making some progress, but it intertwines so much with physical health. And we've separated those systems, and I think we need to bring them back together. So I'm hopeful as accountable care organizations evolve, we'll marry again the physical health and the behavioral health together.
No,
with seniors,
what is it? What's behavioral
it's
health?
With depression and bipolar. I mean, all that stuff has such an impact on one's health care. Yet they're completely separate systems, and they don't talk to each other, and that's a problem. And as you age with dementia and Alzheimer's, I mean, it's. I forgot the percentage of seniors that have some behavioral health issue, but it's well over 50%. It's huge.
It's very high.
And if you don't ignore that, or if you don't focus on that, we can't make great progress in their health care.
There's also a lot of stigma around mental health.
There is.
Access, and so particularly in the communities that we serve, so Latino, Asian, Pacific Islander, you just don't seek that type of care. Because
it's like shameful or something.
It is, and we need to remove that stigma.
And so if you have a health center or a clinic or a medical facility that says mental health, guess what's going to happen? No one's going to walk in there, right? So if it's integrated within your primary care setting, then nobody needs to know that what you're walking in for. And so we're trying to do a lot of integration, and not just of behavioral health, mental health, but substance abuse as well, because that's also very stigma-ridden. So I agree, completely agree with that.
Do the FQHCs include behavioral?
Yes, they do.
As a requirement? Or they just many of them do it?
No, it's a requirement.
That's good.
Oh boy, you just threw out a term there that
Federally qualified health center. She mentioned those. I use the initials because we love the initials in healthcare.
Right. Something we didn't get to, Barry, but I would like to talk to you about it. So at least we'll have it on YouTube for anyone who's interested. And that's the San Clemente Hospital.
Right.
So just what was that about?
Well, it's one of those things where you do the right thing even though it's not popular. I mean, San Clemente is a separate hospital, but it's licensed under our hospital in Laguna Hills, has been since we acquired it a number of years ago.
That's Saddleback.
That's Saddleback at Laguna Hills. And as we moved care from the inpatient to the ambulatory centers, which we do very aggressively because it's the right thing to do at the right price point, that relatively small hospital to begin with, I mean, it's one of 35 hospitals in Orange County, so we have a lot of acute care beds. The number of patients in the hospital went down to such a small number. At one point we were doing one inpatient surgery a day, and we had to ask ourselves, can we really provide quality care with that low volume?
Yeah,
and we're still providing.
You had like how many? You had like 100-some beds.
It had 100 beds, but it never had that many patients.
Never had you had 10 people at a time in the hospital.
It was unusual to have 5 or 8.
110-bed hospital and
so
a handful
of people. It just didn't make sense.
Okay.
We tried to pursue a freestanding emergency department because the community wanted it, but California is one of the few states that doesn't permit it by law. It's unfortunate. We might get there at some point in time. So we spent about a year pursuing that, and it failed in the legislature. Didn't even make it out of the houses. So we decided to close the hospital. We've kept the property because we fully intend to bring it back as a different kind of facility. In fact, I would expect an announcement of a partnership at that facility to bring about a very needed service in Orange County.
Wow.
In the next 90 days.
In the next 90 days.
Yeah.
Wow, that's news. That's news. Let's reshoot this show. No, but anyways, all right. So within 90 days, you know, and it was such a, I don't know if you followed that whole story there, but it just seems like the whole thing was San Clemente wanted it because as an emergency facility, there's a lot of things. People are on the beach, they get hurt, whatever, and it's right there on PCH. And
the 5.
I'm sorry.
On the 5.
On the 5. Oh, I said PCH.
You
I'm
did.
sorry.
That's
On,
okay.
on the 5. That's right. Another hospital's over on the PCH. But yes, on the 5.
Yep.
But anyways, you know, and then so you had a proposal that, look, it doesn't make sense as a hospital, but let's have an emergency, but you needed a waiver from the state.
Yep.
I actually wasted a couple of hours of my life looking at those hearings. And if anybody wants, like, you see the textbook, How a Law is Made, just sit through those hearings. And it was pretty clear that for whatever reasons, the nurses union, and there was another employee, or another union there, that were against it. And they weren't against it. They seem to be, the best sense I could make of it is just because. We don't do this kind of thing, just because. We're against it just because. And that was the clout. And it was, of course, party line vote. It almost looked to me like a couple of the lawmakers who were voting against you were almost apologetic about it.
They indeed were afterwards.
And that, gee, we really wish we could vote for you, but we can't, because it's politics. And so, anyway, so it's good to know that you're going to bring something back. Now, what's happening, though, because the city tried to make you keep it as a hospital, right? They passed a law that,
they did.
Are you still pursuing that?
Yeah, and we had to, which I didn't want to, and I'll explain that. They, in the middle of our ownership, they changed the underlying zoning so that it would forever have to be an acute care hospital with an emergency room. Right. You can't do that.
There's a thing called takings, I think.
There is under the Constitution. It's that little document.
It seems like it's a good bet that won't hold up in court.
But my preference, actually, and I spoke with my general counsel about this, was I don't want to be the big corporation suing the little city. And they said, you have no choice. You're a nonprofit community provider. You have to protect the assets. And they just devalued your assets. You have no choice but to initiate some legal action. Hopefully you can negotiate it away, but you have no choice. And so it's going through that process. I was surprised to see in the process, though, how many legal actions the city of San Clemente has against it. Far more than many other cities around us. And that was a surprise to me. I did not know that.
Okay, well, that's interesting. Okay, well, very good luck with this this proposal. I will look for it eagerly. And Isabel, thanks again for coming on.
Thank you.
Great show. We'll have you back.
Thank you.
I'd love to, love to keep this conversation going.
Great,
okay,
thank you.
Thank you.